Welcome to POCUS Case of the Week. Today we have a 16-month female coming in with 1 hour of new onset MSs at home. She's otherwise healthy, had a normal bowel movement this morning, was eating normal foods, had no sick contacts. She was mildly tachycardic, thankfully afebrile, and on exam had a completely soft and non-tender abdomen. She was getting treated as a early viral gastroenteritis when she actually vomited after she received oral antiemetics, which prompted us to grab our probe. So here we're taking a look at her bowel. Towards the left side of the screen is going to be your liver, and I've thankfully annotated that this is the right side, so right upper quadrant. And as we're looking at the bowel, the first thing that catches my eye is that these loops, the bowel wall, just seems a lot more prominent. Typically, you don't really see the walls that well when it's healthy. And you'll notice there's also a couple of pretty sizable lymph nodes. I'll just grab your attention kind of below this loop of bowel here. And then you'll see one at the end of the clip popping up here, kind of in that more superficial area. So that looked a little odd. And if we look at that same clip with color, you can see there's certainly some blood flow going to both the bowel and those lymph nodes around it. Now that this caught my eye, I'm slowly, again with the linear probe, rotating it until I get a better analysis. And now I get this. And you'll notice we're kind of in the long axis of that small bowel. And I'm kind of cutting in and out of frame with a loop of large bowel that's off screen. But keep your eye on the starting points and the ending point, particularly on the right side of the screen of that bowel. And just to kind of guide you, you can see the bowel's going this way. Right, superior to inferior or left to right. And once it gets to this part, you'll see it doesn't quite end. It folds up onto itself, kind of like this. I don't know if that illustration helps, but here we see a classic telescoping sign. And once I got this view, I carefully twisted it 90 degrees now to a short axis of that bowel. Again, you can see liver tip on our left side. And now you see the classic telescoping bowel with a donut sign, where there's a internal lumen of bowel, and then around it is a large, thicker layer. And sometimes really bad appendicitis, particularly ones with abscess formation, can kind of look like this. But take a look at our ruler, right? This is a small little 1-year-old. We're looking at 4 centimeters of bowel. That's very dilated. Appendix tend not to get this big, and so this is the classic donut sign for intussusception. I'll show you a better clip now, where you can clearly see multiple bowel within bowel layers. Again, most of the time this is kind of idiopathic. She didn't have any clear triggers in the history, except sometimes you'll get these after viral illnesses, and she certainly had a fair predominance of activated lymph nodes near her bowel, to be an unfortunate setup for this. So in the case conclusion, she was diagnosed, thankfully, at the bedside within 30 minutes of her arrival, again, right after you vomited. We were able to get a line and labs. She had a mildly elevated white count, a little bit of acidosis, nothing too serious because this is very early in her disease course. Again, way before she would have had any blood in the stool or those classic currant jelly stool. She was thankfully transferred to our pediatric hospital center Their radiology confirmed intussusception again on ultrasound, and then they followed up by doing an air enema, which caused spontaneous resolution of that intussed section of bowel in the right upper quadrant, again confirmed by a second ultrasound. She was watched in the hospital for another 4 hours for any clinical concerns. She did well, tolerated oral, and was thankfully discharged directly from the ED there. Thanks for watching.